Dental implant is a man-made root made normally from titanium because it's a biocompatible material that replaces the root of the tooth. In comparison with the dental bridge or with the dental crown, we don't do anything. We don't file down the adjacent teeth, but we preserve their structure. So in a way, we're replacing the missing tooth without touching the neighboring tooth. Every healthy individual with good oral hygiene is a candidate for dental implants. If there are any issues with the volume of the bone or the soft tissue, the gum, we can always augment that. We can always replace any missing tissue. But the main thing is to have general health. Uncontrolled diabetes, for instance, is a contraindication for the placement of dental implants. And at the same time, you need a very, very good and thorough oral hygiene. That's exactly the ultimate goal. At the end of your treatment, you should know which tooth is the natural tooth and which tooth is the implant. The success rate of the dental implant is pretty high. For the replacement of the single tooth, the success rate is more than 97-98% on a healthy individual. Smoking or medical conditions like diabetes can reduce the long-term success of the dental implants. Of course, poor oral hygiene and periodontal disease can be a contraindication for the placement of the implants, but if also it's developed during the years of function, again it can reduce the success rate of and the survival rate of the implants. Every procedure is very different, and that has to do a lot with the individual treatment plan, the individual needs of the patient. But realistically speaking, it takes something like 3 to 4 months. This is something that has to do again with the individual. And the minimum care is a visit to the hygienist every 6 months for a patient that they have excellent oral hygiene. For patients that they lost their teeth because of gum disease, the visits should be much more frequent. But also the hygienist, they should have special equipment and knowledge about how to treat dental implants. Looking after the dental implants is different than looking after the natural teeth. You definitely need to keep coming back and do your normal checkups, your normal dental checkups, to make sure that your oral hygiene is immaculate and to make sure that you don't have plaque and gum disease developed in your mouth, because in this case the gum and the bone around the implants will be affected. You will get peri-implant disease and eventually you will lose the implants. So the frequent visits to the hygienist every 3 to 6 months is very, very important for the long-term maintenance and survival of the implants. Bone loss is a complication that can happen either in an early stage or in a later stage that can lead to the loss of the implant. That's why the implants are not fit and forget. You should be coming for visits, to visit the hygienist, and to have everything checked between 3 and 6 months, depending on what your dentist will decide. In the case that the bone is resorbed due to infection or due to chronic dental yes, you will need bone grafts. Sometimes, or most of the times, the timeline is extended. That means that it takes time for the bone to grow, to regrow, and heal again. Depending on the type of the bone graft that we have to do and the type of the procedure that we need, this can be from 3 up to 6 months. In very rare cases, it may be almost like a year. Again, depending on the procedure, the amount, and the type of the bone graft, there is some significant cost implication. The answer is definitely not. The majority of the patients do not need painkillers after the procedure. Bigger treatments with full mouth reconstructions, they require some days off, which is normally 3 or 4 days of work.